Here is an important article about the management of delayed cerebral ischemia after subarachnoid hemorrhage. It's a review article. It's very nice, very comprehensive. I advise you all to read it carefully, especially because you're doing the vascular block these days. One of the important complications of subarachnoid hemorrhage is vasospasm, and as a result, you can have delayed cerebral ischemia. And vasospasm take place in about 70% of patients with subarachnoid hemorrhage. But this 70% is radiographical, and only 50% of this 70% will have clinical vasospasm, meaning that they will start to have a symptom, a neurological deficit. And it's the leading cause for significant mortality and morbidities after re-rupture or re-bleeding of subarachnoid hemorrhage or the aneurysm. So overall, 35% of the patients with subarachnoid hemorrhage will have vasospasm and delayed cerebral ischemia. Why vasospasm is happening? There's so many theories and proposal of causes, pathophysiology. However, it's well known now that there are so many pathways take place to cause vasospasm. Immediately after rupture of aneurysm and bleeding, intracranial pressure increase that lead to multiple pathophysiology pathway to activated, but also thrombexine A2 and serotonin releasing from both the platelet and endothelial cell in the blood vessels will cause local and focal vasospasm. That is not clinically important. In fact, it might be sort of protection for the patient. However, in day 3, as a result of a breakdown of the hemoglobin and the release of oxyhemoglobin, which is toxic to the brain, to the neurons, and to the blood vessels itself, that will lead to a cascade of releasing multiple chemics, including endothelin 1, nitric oxide, and inflammatory process. All of that will lead to vasospasm in 70% of the patient. The peak of that is day 5 and day 7. However, only half of this number will have clinical vasospasm, and that will lead to delay ischemia. In day 5 also, between day 5 and day 7, what's happening is what we call cortical spreading ischemia, meaning that an influx of the calcium and increased release of glutamate will lead to an energy failure or energy crisis. It will lead the mitochondria to stop working and increase the demand for energy. That will lead to activation of the apoptosis process and direct damage to a neuron, which lead also to delay ischemia. This is part 1 of this article, and part 2 is to follow. Thank you.